My name is Ryan Reed. I'm a physical therapist and a practice owner. I'm also a board member of the United Physical Therapy Association. I'm happy to be here with Dr. McCormick, my congressman. He is fighting for us, fighting for physical therapists, fighting for the healthcare profession. And I appreciate you being here. It's a pleasure.
Good to be here. Thanks. It's going to be an interesting conversation.
Yes, I got some interesting questions. Okay. A PT in your district, his name is Tommy. He left the profession to become a helicopter pilot for the Army. Even while in flight school, he made more money than as a doctor of physical therapy who completed an orthopedic residency and as an orthopedic specialist. There are numbers anywhere from 15 to 30% of the PTs in the PT profession have left the profession since 2020. These are some of the top providers in our fields. Is there any encouragement you can give to physical therapists in your district despite consistent CMS cuts and insurance payer cuts?
I think everybody should be a helicopter pilot. I think it's a great profession. That's a joke. Actually, to hover is a divine aspiration. I'm a helicopter pilot. For people who don't realize, I was a Marine for 16 years. Also jumped out of them. Never trust a pilot who can jump. It is a higher calling, just like PT is, by the way, too. In PT, you're actually healing somebody. You're actually putting hands on them. You're actually doing the higher calling. The surgery is one thing, or the injury is one thing, but the healing process, there's no better way to break up scar tissue. There's no better way to increase mobility or get somebody strong than physical therapy. No drug is going to do that for you. No program is going to motivate you. Your impact is a calling, but I'm not telling you to do it because you're taking teacher's pay. But if you're going to get anything out of this, some of it's supply and demand, understanding what product you bring to the table, marketing your value added, and quite frankly, just like with chiropractors, I've seen chiropractors cut their hours, reduce the patients they see, and make more money because of supply and demand by reputation. So there's a little bit of business and marketing involved with that, reputation involved with that, but also having a good business model. What is my business model? It has to do with lobbying and regulatory burdens and taxation and stuff like that with Congress or some other entity that oversees you. There's a reason that some physicians do way better than others, and why some people are suffering in a $5 trillion industry, which we call healthcare in America. $5 trillion being the third largest economy in the world by itself. Where I'd say there's about $1 trillion of waste, fraud, and abuse per year that we can eliminate and put in good people's pockets to actually do good work. But if you're going to succeed as a physical therapist, for example, you have to have a marketable skill, you have to have a good reputation, you have to bring value added to the table. In other words, how does this reduce the cost of medicine, make your life better? How is this better for you than a drug or anything else that I'm offering in that holistic approach to medicine?
Right. Yeah, I think in the profession, we see a lot of PT practices. It's not the volume that's the issue. Some practices, therapists are seeing 3-4 patients at a time, right? And it's because the margins are so thin. Yeah. I think it's not just, I know everyone wants to look at CMS, not just CMS cuts. It's the insurance contracts that you get, Blue Cross Blue Shield, for example. For our practice, we had to wait 4, 5, 6 months to even get in network with them, even though we provided a specialty vestibular dizziness balance aspect that a lot of clinics don't offer. And so I think the big thing too is like where do you see on the Hill from the CMS cut side? What's some of the legislation that you're fighting for that we should also be fighting for?
How about the value added to requiring insurance companies do what they say, which is make a patient better? The fact that they don't finish the job, the fact that they have 40% denial in the ER, that they mess with your pre-authorization, they mess with your medications, they mess with the reimbursements, they mess with everybody. They're not good actors. They're four of the top 10 companies in the Fortune 500. 7 of the top 20 are insurance companies. They're making massive profits,
right? And
they're great lobbyists. But are they delivering the product to the patient who ultimately pays the bills, whether it be through a premium or through your taxation? The fact that we don't have a stronger finish to our product, which is a lot of times physical therapy, right, is actually criminal to me, right, in my opinion, where you're literally billing people and then not delivering them the most important, the final finishing product to make you a whole and fruitful person.
Right, right. So in our practice, United Healthcare, for example, decided that it was going to change its authorization practice for Medicare Advantage plans. 13 of my patients, we did not get the authorization needed. Okay, and so when we submitted and we asked for payment, they waited months before they told us we didn't get the right authorization. And so not only did we have to write off the couple of weeks where we made the mistake, we had to write off 4 months worth of care. Then United Healthcare then churns with Optum, and they say those patients, all those visits that you had to write off, that now goes to their plan of care, and then they deny them any more visits. And they say, well, you already saw them for those. And I go, well, you didn't pay for them. They go, doesn't matter. So
this is criminal. Yeah. So this is what I'm talking about. So this is where we need to come up with creative ways to actually address these problems, where it's not just allowing them to use the loopholes to purposely deny payment, purposely deny something that's needed in a timely manner. The most important time is right at the beginning of physical therapy after a stroke or a wreck or a surgery or whatever it is. The fact that they get away with this, they're some of the worst acting people in this business. It's a $5 trillion business. There's a reason that they're making record profits. They make fun of it in Mr. Incredible, when he's an insurance agent broker and he's being told by his boss to find a way to deny some claim. This is what insurance companies do. They're the biggest lobbyists in DC. They're the biggest people in business, and somebody needs to stand up to them. I mean, quite frankly, this is one of our big fights when we talk about what's paying for healthcare in America. When you have people paying 2 to 3 times the premium that they used to pay, and having less and less product, more and more denials, they're having surprise billing, and nobody's able to do anything about it legally. And we actually have a surprise billing law now that's not even been enforced by Secretary Becerris, where he lost 4 Supreme Court justice cases as a lawyer, by the way.
Wow.
Because he was trying to service that special interest, in my opinion. That's just wrong, and we need to do something to address that. And being part of that lobbying effort is not just me talking to other Congress members about how we correct this wrong, but how we get people involved so we can multiply our effect. Actually talking to patients, making them advocates, talking to other congressmen, talking to businesses, talking to people who have to pay their premiums and then don't have the results on the premiums. Shame on those guys for doing that, because ultimately this should be about the patient, not about your stockholder.
Right. Yeah, and we see even with insurance companies here, especially in Georgia and your district as well, we see with the hospital systems. In physical therapy alone, hospital systems will see anywhere, they bill the same practice, outpatient, just like in a shopping center like this, they'll get 2 to 3 times the amount per visit because they're able to lobby the insurance companies to get these large contracts. So these hospital systems who are nonprofit, don't pay taxes on property, we don't have to get into that, but they take that money and then they make hundreds of millions of dollars, and then they could buy up physical therapy practices, and then they immediately can get a higher reimbursement. And we see that in primary care, orthopedics, right? Taking an x-ray through a hospital system versus private pay. What are your thoughts on the site neutral reimbursement?
First of all, it's absolutely necessary. The cuts that we're doing every year, the mandatory cutting to reimbursements without site neutrality. In other words, physicians and other providers get a 2.8% cut last year that we have to patch every year. They try to do a cut. They don't do that for hospital systems, that you're saying. So what does that mean? You force more and more practitioners and therapists and everybody else into a hospital system. To save 2.8%, you force them into a system where it costs 15 to 30% more. So you spend money to get a worse product that's controlled by a monopolistic, aggressive territorial system that doesn't benefit the patient. Once again, ultimately, it's a disservice to the patient because insurance agencies and hospital systems get to run the show. The actual person who sees the patient doesn't control it anymore. It used to be about 17% of all doctors worked in a hospital system not that long ago. And now about 80% of all doctors. Why? Because of regulatory burden, because of reimbursement problems, because of the fact that lobbyists have owned the day, and they're forcing us into a single payer system that's even more expensive, with the people who aren't paying taxes benefiting and the people who pay taxes going out of business. It's insane.
Right. Right. I see that a lot. I see a big push for the single payer system. I was actually with my father. We were going to the town halls during when the Affordable Care Act was being pushed out, and they're like, you have to pass it to know what's in it. And then I remember the vitriol and the divisiveness of the conversation, yet no one knew what they were arguing about. And so when it came down to it, we feel like, especially in healthcare, things have gotten worse. Instead of more affordable, things have become less affordable. We've seen a bigger pinch. I saw a number that physical therapists with the rate of inflation have seen like about a $7,000 cut in how much take-home pay we take, despite now all our programs being doctor of physical therapy. I have my student here with me. The PT programs cost anywhere from $100,000 to $150,000 to go through. That's just the tuition.
Yeah.
So they come out with all this loan, all this burden, and with consistent cuts, we're not seeing the rise with inflation. And I get told all the time that I don't have any lobbying experience. I haven't met with enough Congress people. What would you tell someone like me or other therapists that don't have any experience of this in lobbying? What can they do to help fight for their community, fight for their company?
It's extremely rare that anybody ever reaches out to their congressman and realize, first of all, you have friends, you have allies that you don't even know about. What you're experiencing on all those things you just discussed is a microcosm of the bigger scheme, which doctors and nurses are going through too, by the way, especially doctors. Doctors have taken about a 20% cut when adjusted for inflation in the last couple decades. And the cost of medical school is insane.
Right.
So yeah, they make more money, but their costs of applications and medical school and all that stuff like that is also insane. So you actually have an ally in the MDs with the PTs.
Right.
And I'll say that when you go forward and you actually talk to your congressman, when you actually put time and effort to actually pick up the phone or go in person, which is even better when they're in the district, and say, hey, I need a meeting, I need to talk to staff at least, and let me tell you why. And selling your points, making sure you're concise, making sure you understand the added value to the patient, because nobody cares whether you make money or not. Just like nobody cares how much a doctor makes. They don't care. What they want to know is this good medicine delivered to patients at an effective price? And what happens if you're not around? What if you do get hurt? What if you do get put out of business? Well, then you're going to have a more expensive, worse product. That's what we're selling. Nobody cares how much you make. But the fact is, if you don't make enough money, you go out of business or become part of the hospital system and patients get worse care. That's your selling point.
Right.
Once again, I never come at things from the standpoint of how much a doctor makes, because nobody cares how much a doctor makes.
Right.
But if I say to you, your medicine is going to become 15 to 30% more expensive and you're going to have less services and less variety and less choices, and it's going to get more and more expensive every year, people will go, what did you say again? Right. Because they want to know. So it's how you market it. It's who you talk to that actually gets to make the regulations going forward that will affect your future pay and your ability to keep the doors open.
Right. Do you think the lack of lobbying from physical therapists or other private practice owners across the healthcare has suffered? Do you think that's why when the AMA or the hospital association, I think they had something like $10 million last year in lobbying alone. Do you think that's why CMS, they're having less cuts while we see cuts every single year?
We realize that the American Medical Association is not paid based on how many doctors belong. It's based on a coding system, which is built in the regulatory system, which is why they support anything the president or any legislator says, because that's how they get paid. It used to be a very representative body, and I met with them recently. I want them to succeed. I want them to be representative. I want them to help with this medicine. But you can't be sold out to government interests. You have to be sold out to physicians' interests as the AMA. Likewise, when we talk about a product that's going to be delivered and what value add you bring to healthcare as a result, and who represents you and how you get in with people, you have to break down why it makes sense economically. Let's face it, we're in a $5 trillion industry of healthcare. $5 trillion. A massive amount of waste and fraud and abuse, but people don't want to see their benefits cut.
Right.
But they don't want to see waste either. You have to sell yourself, what your product is, how you make people's lives better. That's ultimately how you market any product. I just think we have a lot of work to do, though, because I think we're not doing a good job of marketing through our patients. And what I mean by that, when you have somebody walk into your lobby and they're waiting for their appointment, you should have literature there in very basic, 1 page long, by the way, in color, saying, this is why I'm important to you, and this is why you need to talk to your Congress about this issue. If nothing else, you educate them so they become advocates for you in their daily conversations with other people. If it only sinks into 1%, think about 1% of the entire PT population nationwide. Now you have an army. If you can get people interested, give them a contact number. Say, this is how you can become an advocate. This is who you should contact. It could be regional. It could be your district. It could be your district congressman's office. This is how you contact them. This is what you need to talk about, or you're going to lose your benefits. Give them a little bit of scare tactics about why this stuff matters to them and why they should be fighting for you as physical therapists. That's part of the marketing scheme.
Right. The UPTA is actually, Scott, our president, was talking about actually having actual iPads in the clinics. As patients come in, they could send a letter to Congress and sign up, something easy, so we can start to increase our efforts, not just from the PT side, but like you said, using the patients as our advocates. In our clinic alone, we have 100 patients that walk through the door every week.
There you go.
And how impactful that would be in a district to help push Congress in the right direction. And I know like the SAFE Act is something that's important right now. It's pushed by multiple associations in our profession. And I want to encourage you, like if you see that, it's something that we're in favor of as well. And it will help elderly patients at high fall risk, that Medicare will pay for a screening at least. They pay for an evaluation, a mobility evaluation and a fall evaluation with their physical therapist. Just like if you had a physical, you go see your physical therapist, and we can at least do a fall evaluation with the patient.
I want to address, and I agree with everything you just said. That's phenomenal marketing. One thing that marketing, from my experience in the last couple of years only, and I'll specifically address my disappointments in the system. I went to one physical therapy appointment after doing my shoulder surgery, and I literally sat outside while they took their lunch break. It was 100-degree weather, and I looked like a sad puppy on their doorstep while they all sat there and just jaw-jacked and looked at me and went, "It's not open yet. Let me sit in your lobby." That's good business, right? That's excellence wins. There's really good books written on that. That's a business model. You treat people like you treat them as your family. Right. When you see somebody make a car claim where somebody's bumper got tagged, but it didn't leave a mark, there's no car claim at all because it's that soft. And then there's a $10,000 physical therapy bill, $10,000 bill that goes against my insurance company. All of a sudden now I have a beef with my physical therapist that I don't really like you anymore. So policing your own is a great way to sell your product. Right. When there's waste, fraud, and abuse, it doesn't matter who it is, it's bad business.
Right.
Always remember the business model that works for everybody, no matter what you do, whether it be physical therapy, being a doctor, being a lawyer, being whatever you are. Your reputation is based on not just you, but your entire community. We have to police our own.
Right. I think that's awesome. I'm sorry about the story. You come see me. I'll be happy to be your physical therapist. And I'll give you a key. So make sure you come in. So, but I think that's really important for all healthcare professionals. I think you would see less of that if the doctors, the physical therapists, if their name was on the door, if they were owners, if they had more investment. I feel like the big business, I call it the McDonald's of PT, right? We're every single place, and you never know what you're going to get when you walk in. Is the ice cream machine going to be working? Do they dry needle? Maybe, maybe not. What service do they add? Is it a new grad? Is it an experienced clinician? And I think when we empower the clinicians more, like you're talking about how a lot of physicians don't own their own practice anymore. I think you've seen that decrease in care and courtesy and customer service, because in healthcare we are a customer service experience.
Yeah, very much so.
And we should have the backing of the people, and that means we should provide a good product. But it's hard to motivate people if you give them a way out. And I feel like if we can empower the clinicians, we'll see a better product. We'll see a better healthcare outcomes. And I know especially with the Make America Healthy Again, I know that's a big push in America, and it's something that I'm personally in favor of, and I would love to dive in and help you in Congress. Is there any way physical therapists in your district, people in your district that see this video, is there anything you could tell them to help you on legislation moving forward?
Well, if you have any specific suggestions, things that make things better, especially when you come from a collective body. Most people don't know legislation. They don't understand how it affects them, doesn't understand how the business model ties in with it. But if you have suggestions, make sure you reach out to your congressman and say, hey, this is the kind of legislation that matters to me. When a bill comes down, something that you guys have designed, you're talking to somebody, regardless of who's heading it up, make sure you reach out to your congressman. Make sure that it's something that makes sense for the patient. Ultimately, that's what sells your product. Once again, it should be a nonpartisan issue. Unfortunately, we've made it a partisan issue. And once again, when it collectively benefits one group or another that donates to one party or another, you fail. But if you make it about the patient, no matter what party's in power, you succeed. And I think that's what people have to understand about their lobbying efforts, and then getting involved, because most people just plain and simple don't get involved.
Awesome. Well, thank you for meeting me. I really, really appreciate it.
Absolutely my pleasure.
Thank you so much. Thanks.
Thanks.